have blood type B are more prone to autoimmune disease, because you got to understand this. Your B cells are very sensitive, right? So that comes from B cell formation, as well as your inflammatory responses, as well. Those contribute to your autoimmune disease, putting you at risk of autoimmune disease. So what happens is your B cells are very sensitive, right? And so sometimes when we're talking about the metabolism or the B cell, meaning that if there's some abnormality with the metabolism of the B cells, it can slow down the receptors. All right. So sometimes you have some antigens that will get past the autoimmune, those little doors, the doors that kind of block certain disease processes or certain antigens from getting past. Sometimes they're slow to respond to that. And so when certain antigens pass by those doors, your body thinks that it is a foreign, that it's a foreign object. And so it begins to attack itself. All right. That is why you guys are more prone to having those diseases. All right. So you have antigen, you have antigen recognition, inflammatory pathways, and B cell functions. And it leads to those abnormalities. It leads to those B cell metabolism, or the slowing of the B cell metabolisms. Okay. So if I'm making sense to you guys, drop a blood, icon down in the comments. If you are following me on TikToks, if you understand what I am saying, or if you would like to comment, or if you'd like to call and just give a statement or have a question, feel free to call the station at 219-933-9922 or 773-288-9922. All right. All right. Thank y'all for the drops of blood. I see the drops in the comments, so this is making sense. I just want to make sure that this is, I know I'm speaking